Commiskey in Albuquerque, New Mexico. This is one of the marquee surgeries for our cornea service at the Eye Associates of New Mexico. So this is a patient who had a complicated cataract surgery referred in because of raising intraocular pressure, the development of glaucoma, recurrent bleeding. So for this patient, we are performing a goniotomy where we relieve the obstruction in the drainage pathway. We also are going to remove the entire lens bag complex, which is loose and banging around inside the eye, causing inflammation, causing the pressure to go up. So here we're sort of setting our stage for the scleral sutured intraocular lens. We make those two peritomies, or openings in the conjunctiva, in order to access an area where we're going to sew in our lens. We place a port to do a vitrectomy, which improves the safety of the surgery quite a bit. Then we make a scleral tunnel. We make this tunnel there and enlarge it a bit. This is going to be the entry point through which we will remove the previous lens bag complex, which is dysfunctional, like so. And it'll also be the pathway through which we sew the new lens. So here I'm removing all of the residual lens bag complex and being very attentive to get everything and all the material out of the eye, so there's nothing left over to cause troubles. Doing a thorough vitrectomy, anterior vitrectomy while we do that, so that the vitreous does not come into our surgical field. There I just made a couple of small holes in the iris that you can't even see. It's underneath the kind of rim of the cornea there. That'll help relieve any reverse pupillary block where the pressure in the front of the back of the eye needs to kind of be equilibrated. I made our little sclerotomies there that are 180 degrees apart. We have our new lens, and I pass the suture through the eye and pull it out the outside of the eye. This is Gore-Tex suture, which is very stable, long-lasting in the eye. And the type of lens we use is the CZ70. That's the most common lens we use. Our practice has found that this lens has the least amount of complications with the Gore-Tex suturing, not really having an issue with tilt or decentration or the haptics breaking or kinking or having a rotisserie effect. It's a nice broad optic. It's FDA approved for use in the sulcus. It requires the larger scleral tunnel incision, which and a little bit longer OR time, but we find that it's worth it. We really don't see these patients come back. I do consent the patients that there is a 1 to 2% risk of a vitreous hemorrhage that is non-clearing or a retinal tear, and so we very carefully counsel the patients for that risk, afterward, and that they come with any symptoms that they may develop for that roughly 1% risk of the retinal tear. So we've sutured our lens in, and now we're just closing up that scleral tunnel, that pathway there with 10-0 nylon. Then we'll cut all of our suture tails small, and then here we'll just be burying the knots inside the eye so that there's nothing pokey and nothing that erodes and causes trouble down the line. Again, in our hands, and this is over years and years of cases, hundreds of cases, we've found that this technique is quite safe and very low in complication rate. So here we're just sealing up the incisions, and then we close the conjunctiva so that everything is sort of neat and tidy at the end of it. Well, that's a good little overview of how we do the surgeries. This surgery technique was developed by Greg Ogawa, who is a wonderful, wonderful man and mentor here to me at the Eye Associates of New Mexico, who's um, just been a fantastic person to work with. So that's the end of the surgery. We put in a little bit of antibiotic and steroid just to get the healing process going. And I started putting this little bubble in as well.